Hello everybody, I am Dr. Pulkit Nandwani. I am a consultant, gynecologist and laparoscopic surgeon here at Saroj Medical Institute, Rohini. Today I would like to share some information to you about fibroids. Fibroids are becoming increasingly common these days. They usually occur in the age group of 30 to 40 years of women, but can occur at any age group, usually at the age group of 30 to 40 years. Now what are fibroids? Fibroids are usually non-cancerous, just an overgrowth of the muscle tissue of uterus. Fibroids are also called myomas or leiomyomas. Now these fibroids can be located anywhere in the uterus. They can be either in the muscle tissue of the uterus or even in the ovaries or from a stem hanging inside the uterus or out of the wall of the uterus by hanging by a stem. The size, location, number of fibroids vary a lot, and according to them the symptoms depend. Now what are the symptoms of fibroids? The symptoms of fibroids depend where the fibroid is located, how big it is and how many number of fibroids are located. The symptoms can be, they usually cause change in menstruation. The patient usually experiences heavy bleeding with painful cramping, and now instead of monthly bleeds, the bleed may come at irregular intervals and at least twice or thrice in a month. Then there can be pain during bleeding. Other than the painful bleeding, the fibroid can also result in pressure symptoms. Because of the size and the weight of the fibroid, it might press on the urinary bladder and the patient might experience frequency of urination, even pain during urination. Same if it is at the back of the uterus, it might press on the anus and cause painful defecation, pain while passing motions. Because of the heavy bleeding, patient might land up with low hemoglobin and having anemia, and generalized symptoms of anemia like fatigue, weakness, loss of strength, loss of stamina, all these symptoms are of fibroids. Just a pain in the lower abdomen can also be the manifestation of fibroid. Fibroid can also cause infertility. Patient might find difficulty in conceiving, or there are chances if the patient conceives, if the fibroid is located inside the lining of the uterus, it might cause increased chances of miscarriages, there might be abortions. But the good thing is that fibroids rarely causes cancer. It might twist on itself, cause severe pain, but it rarely causes cancer and grows over a period of time. It slowly grows over a period of time. Sudden growth is a matter of danger sign. Now what are the treatments available for fibroid? Fibroid, if it is asymptomatic, the patient is comfortable, it was just a routine diagnosis, need not require any treatment at all. But usually fibroids causes bleeding problems. So the most common treatment that we employ is start first the patient on medical treatment. A number of hormonal pills come which regulate the hormones inside the body of the uterus and limit the blood flow of the patient, and the patient remains comfortable. If medical treatment is neither not successful or by the location of the fibroid, we already know that medical treatment will not work, as in case if the fibroid is coming inside the lining of the uterus. In those cases, the fibroid has to be removed. Surgery for the fibroid is usually done if it is coming inside the lining of the uterus, even if it is very small, or a big fibroid is obstructing the uterus lining, causing pressure symptoms. In that case, surgery has to be done. Now for surgery also, there are 2 to 3 types of surgery which can be done. If a patient is young, she has to conceive again, her family is not completed, we try to remove only the fibroid. It is known as myomectomy. And if the patient is elderly in age, family is completed, it's causing a lot of problem, or there are multiple fibroids, in that case the modality of treatment is a one-stop treatment in which we prefer to remove the whole uterus, in which case it is known as hysterectomy. Regularly, total laparoscopic hysterectomy fully by laparoscopically is done routinely at our hospital at Saroj Medical Institute for fibroids. So this is much for fibroid for today. If you have any query, you can contact me at Librate. I am Dr. Pulkit Nandwani, or you can even take a consultation appointment at Saroj Medical Institute, Rohini, Delhi. Thank you.